elderly people are and don't have the pensions that, like my husband's shop didn't have a pension. And if you don't have the extra income, then you really, the donut hole will kill you.
Yeah,
Exactly.
Well, also, the problem, as you're aware of, is that the federal government always guaranteed a COLA, cost of living adjustment, for Social Security, and they've been cheating hell out of the seniors. They have not given them the real meaningful COLA, and according to the people that do that, who do the figures on this, say the seniors are getting 40 cents on the dollar now from 10 years ago.
Well, that's
rough.
And that is rough. And you know, seniors, in my mind, should not have to choose between getting your medications or paying your taxes or trying to pay for your groceries.
Well, there's one thing about being so poor: you don't have to pay near as many taxes, because there are programs, at least in our town, there are programs where they will give you tax forgiveness if your income is below a certain level.
And that's good, and that's very positive, because it is tough to be on a fixed income when you're a senior. So that's why we worked very hard to restore the EPIC program. The co-pays now will be anywhere from $3 to $20, and I think that'll help a lot of seniors.
Well, thank you, caller.
Thank you.
Have a good day.
You too.
Thank you.
Yeah, one of the interesting things about this is that I don't know, we seem to be spending a lot of money. They keep saying the state is overspending. And where are we going to get that $2 billion shortfall now? As you know, Chautauqua County is now the highest tax county in the United States.
Yes, and that's why we need to change that.
Right.
And that's why we actually passed the property tax cap, to put the brakes on these property tax
all local jurisdictions have simply just laughed, and even before they've exceeded it, said we're going to exceed it.
I don't know if all of them. I think that when you look at the statistics, most of the localities have stayed under the cap. Now, a few have broken the cap, but I think it makes the point that the public is paying a lot closer attention to these issues than they were in the past.
I agree, because there is that joker in the law, that is, that all you have to do is say, I don't want to do it, and that's it. You don't need to go by the tax, the 2% cap. And a lot of, as I said, towns around here in Chautauqua County have already said beforehand, they've enacted legislation we're not going to go by it, period. Although some of them, you say, it points out they're going over what we supposedly have as a reasonable limit.
Right. So, you know, the public is paying attention, and I think that's really good. People should be involved in their government. So you had the story earlier about the new federal law that prohibited protests, or actually put a damper on protests.
Right.
We need to hear from people, and that's the best part of my job. I work very hard to be interactive with my district, because I can't represent folks unless I know what's important to them.
Well, that's why you are one of our best senators, because you do come and report to us and give us information. Anybody can call in and talk to you regularly. That little law, the law that basically kills our First Amendment to protest, was sneaked through, and no one saw anything about it. Nobody knew about it. There was no public reaction, nothing. Just whipped it through, and that was it. They don't do that in the Senate, do they?
No, I mean,
State Senate, I mean.
No, I mean, for example, the budget this year, we actually had the budget plan out there for 3 days. It was aging so that people could get their input on it. They were able to know what's in it. And, you know, in the past, sometimes there have been what are called messages of necessity, where the governor sends down a bill and you don't have enough time to review it. I think that's a very bad practice. That's not something that I support. It's happened over in the past, and I think that the way the budget was passed this year, it was not only on time, it was actually early this year. It actually had no new taxes, it cut spending, it restored important programs like education and the EPIC program, for example. I think it was a really good budget, and it was done in the light of day. It was done with a lot of public input. We had hearing upon hearing, and I had so many groups who came to my office, and I really appreciate the emails and the letters that I get from people.
Well, you're quite communicative. You did use an important word, though, there, restored. In other words, you got this education money, suddenly the education budget is up, but it's up to what it was 2 years ago when they cut it. So we're basically a couple years behind in terms of inflation and cost of oil, I might add, for heating up here. Holy mackerel.
Oh, I know. I know. The energy costs are really out of sight.
They're rabid up here.
Right.
What are they going to do about Medicaid? New York State is one of the 2 states, I believe, that requires that the county pay a chunk of it, and we have to pay half of it, half of the state's amount.
It's structured differently in every state. So, for example, the counties keep more of their sales tax, but they do foot some of the bill for the Medicaid program. In other states, the counties don't get as much sales tax or even any sales tax, but the state pays for those Medicaid services. And you know, we have to streamline and reduce the Medicaid program as much as we can, but I think there's a kind of a falsehood out there that says that Albany, I've heard this actually said by some local officials, that they say, well, all that money is being sent to Albany to pay for other areas of the state, and it goes for waste, fraud, and abuse. Any Medicaid dollar that's spent in Chautauqua County actually goes to pay for health care of Chautauqua County residents, and most of that health care is provided to seniors. So I know everybody in the audience knows of someone who's had to go to a nursing home or needs some kind of service through Medicaid, and that's where those dollars actually go. But there is some waste and fraud in the system, and that's why Assemblyman Goodell and I have legislation that would actually empower local governments to be able to go out and enforce and look into those things.
What are the major cheats doing?
Well, there are different things. Sometimes people collect benefits and they're not eligible for those benefits, and we can talk about welfare in a minute if you'd like too, because that's another program that really costs the taxpayers, and you know, you need a safety net for people at certain times.
So they just got a big Cuomo just gave them a nice big raise.
Right, exactly. So I'd like to talk about that in a second. But under the Medicaid program too, sometimes, I'm not saying this is in Chautauqua County, but sometimes providers have really ripped off the system. And for example, a couple of years ago, there was a dentist who was collecting for 900 procedures per day. Now, you and I know good dentists, but we don't know anybody who's that good.
No, that's the wind. He's fast. That guy's
Yeah, it was actually a woman, and she ripped the taxpayers off for more than $1 million before she was caught. And the reason she wasn't caught right away is because she was a dentist who was actually billing for dental procedures. If she had been billing, for example, for brain surgery, she would have been caught sooner.
Yeah.
But the point is that sometimes there are crooks out there who are putting in systems where they're cheating the Medicaid system, and that comes back and that hurts every single taxpayer in the state.
Of course, Kathy, reminds me of my dentist. Medicaid often pays far below the market level.
Exactly.
It's unhooked from the system, really, and you can't find people to do it for you under Medicaid in many cases. My dentist down in Long Island used to say, you know, they gave me, this was back in the 70s or 80s, they gave me $5 for doing somebody's tooth, filling it. He said, it's $50, it's $60. So when I do somebody who is on Medicaid, and he says, I take Medicaid occasionally, and it's just a gift. It's pro se. I'm just not going to charge them. And I don't write the stuff up because the forms are so complicated and take so long. Then you send them in, and then they come back, you forgot to dot an I or something, you know, and then you have to redo the forms. And he said, it's not working. It's not working.
No, it is. It's a very difficult bureaucratic system. I agree with that.
Right. Well, there's a whole business down in Long Island. Somebody prints out brass signs that say, we do not take Medicaid.
Right.
And all the doctors have them.
A lot of those, though, as you know, the Medicaid program actually is a federal program, so it comes down from the federal government to the state, and then the state decides how it's run. So about 50% of the Medicaid costs are paid for by the federal government, and actually about 22% is paid by the local government, and the state picks up the rest. So the state is picking up about 27, 28% of the Medicaid costs.
Everybody's hollering and saying it's bankrupting all the small counties, especially the rural, poor counties.
Well, one of the things we did in the state budget this year is that we were able to cap the growth of the Medicaid program, and that'll save billions of dollars over the next several years for the counties. So that's a really good step in the right direction. Now, I actually sponsor legislation that would have the state fully take over a period of years, take over the entire cost of the Medicaid program.
Well, that's going to have to happen.
Governments.
I mean, that makes good intelligence because local communities can no longer take it because Medicaid has become from a emergency situation, it's become the basic, the shortfall, the last ditch for anybody who doesn't have health insurance. And fewer people have health insurance in New York. The companies are cutting them out. The state is cutting a lot of the funding. And in the meantime, they have to go on Medicaid. And now it's becoming a crushing burden to a little county like Chautauqua.
Right. So there are different things that we can do, though, as a state. I think that there are ways that we can make health insurance more competitive, bring the cost down. Those are things that we need to take a look at.
Sure, okay. We got a phone call. Someone wants to ask you a question. Good morning.
Excellent.
Good morning, Reed. Good morning, Senator Young.
Good morning.
I was wondering if you could give us an update on the regional high school concept that we've been hearing so much about.
Yes, I'd love to. I'd be glad to.
The regional what?
The regional high school concept that we've been talking about.
Okay.
Actually, there's legislation that I sponsor in the Senate, and it would allow for a demonstration project in the BOCES districts within my Senate district, and it would allow schools to be able to form a regional high school if they have a public vote, and the collective public vote says that the people want to form this regional high school. And really, the whole impetus behind this is that we want to increase opportunities for our kids, academic opportunities, sports opportunities, extracurricular opportunities that they may not have now because we're rural schools, and it's tougher to have the resources to be able to provide all those extras.
It makes perfect sense. Unfortunately, when you vote on it, it always goes down. The Brockton, Fredonia went down a couple years ago.
Right, and that's for mergers.
Westfield,
this is a little bit
Sherman
different.
went down. Everybody wants to keep their own school, and they're not about to let it happen.
Well, that's what makes regional high schools different in that you would keep the elementary schools in the home communities, and so people would be able to keep their schools, but you'd be able to form this high school.
You think that'll work?
Yeah, I do, and there's a lot of interest across the state. I've been contacted by a lot of school districts. I have a statewide bill too. So we've had this bill in, we passed in the Senate last year. We're able to amend it this year to make some changes because we wanted to make it as strong and as good as it possibly can be. And so we've made these changes. I tried to get it done in the budget, and the Assembly was not going along. The Speaker did not want to do it in the budget. And so now I plan on passing it before the end of the year. I think I'll be having at least one hearing on regional high schools. I may actually have it here in Chautauqua County. And we're really hoping for a result this year that we can get the Assembly there to pass the bill and get Governor Cuomo to sign it.
Okay, Chautauqua Central School is one of those bills that did come together, and they built in this beautiful new school down here.
It is, it's gorgeous.
Yeah, and it didn't cost them anything.
Right. So, so that's where it's at. Did you have any more questions on that?
Oh, we got another phone call.
Oh, okay.
He got chopped off.
He got chopped off.
Hey,
I'm
good morning,
sorry.
caller. Thank you for waiting. Hello.
Good morning. Good morning, Kathy. Good morning, Reed. This is Linda Spalding.
Well, hi, Linda Spalding.
Hello. How are you?
I'm fine, thank you, Kathy. It's so great to see you on the show this morning.
It's so great to be here.
She comes all the time. It's wonderful.
And thank you for clarifying so many issues and myths, especially those associated with Medicaid.
Yeah, it's interesting because there are a lot of different, as you said, myths out there, and there's some realities that we have to deal with. And so the question is, how are you able to continue to meet people's needs who truly need help, yet reduce the burden of taxes on everyone else? And it's a very tricky proposition.
Yes, it is.
The wheels coming off the Cadillac. We have the Cadillac of all health care, all Medicaid systems, they tell me. And the wheels are coming off.
Right. So, but I think that we're making great progress, and I think that's what differentiates Albany from Washington right now, in that in Albany we've been functioning, we've been able to get several things done, and so things are working again, and I couldn't be happier about that.
Good. Well, thank you, caller. Anything else?
Yes, I thank you, Kathy, so much for all the support and encouragement you have given to the Senior Employment Program at Chautauqua County Office for the Aging, and the support that you've given also for our community computer training, basic training for seniors.
Well, that's great, and you know that I love the Office for the Aging. They do a phenomenal job. I love to go to my senior centers. You know, you were talking about several of them earlier today, and I've been to most of those. And everybody works together to make sure that we have good quality of life for our seniors in Chautauqua County, and that makes me very proud.
Incidentally, I heard that they're moving a trailer down to the park for the Office for the Aging now.
No.
That it had Office of the Aging right on it, and there's a little
No,
trailer.